cancer patients, which I know you guys have heard a little bit about that this afternoon and earlier this morning, but we'll kind of go into a little bit more detail. So some of the most common side effects we see in clinic at time of diagnosis, patients can present with difficulty swallowing, feeling full easily or early satiety, acid reflux. Sometimes patients can have excessive secretions or mucus production and then bleeding from the tumor.
And with difficulty swallowing or dysphagia, that can be resulted from tumor blocking the stomach, blocking the outlet, or if it's up high, it can be blocking the entrance into the stomach. It can cause pain. Ideally, chemotherapy will shrink the tumor and allow for easier nutrition, easier swallowing, easier eating. In the meantime, until that can occur for people who need it, then the feeding tubes will offer an alternate source of nutrition in order to replace what they can't get with eating.
Another common symptom, feeling full easily or early satiety, like we mentioned, which I know we've gone into detail about this, but we recommend eating smaller, more frequent meals in this case. Sometimes this can cause patients to lose weight because they're not able to tolerate as much as they did prior to their diagnosis. And so in those cases, if they're not able to get in the proper nutrients, then that's when we place the feeding tube.
Acid reflux is a very common complaint. Burning sensation in the throat, feel a lump in your throat. Some people complain of a cough. Oftentimes, antacids, proton pump inhibitors, Pepcid, Prilosec, Protonix, omeprazole, those things can be what's prescribed to help keep those symptoms at bay.
Excessive secretions. Some patients can present with these symptoms. The tumor can cause mucus production. So patients can say they have excessive mucus production, cough, nausea, vomiting, all due to this. So many of our patients are prescribed medications such as a scopolamine patch, which goes behind the ear. I'm sure some of you are familiar with that. It helps with motion sickness, or another medication called glycopyrrolate, which is a tablet, and it can help dry up the mucus.
And some patients present with a bleeding tumor. This can be something that causes an emergency room visit. Patients can have symptoms of vomiting, blood or coffee ground emesis, black tarry stools, also fatigue, shortness of breath, dizziness, and things like that that will send them to the emergency room. Oftentimes these require checking the hemoglobin level, which can result in a blood transfusion. And if that doesn't really help, then some treatments can involve endoscopic treatment or radiation even to help control a bleeding tumor.
So some common side effects we see during chemotherapy, nausea, vomiting, diarrhea, fever can be for some people, neuropathy, which is that numbness and tingling in the extremities. Also cold sensitivity is a big one with certain chemotherapies, mouth sores, fatigue, and hair loss.
With the nausea and vomiting, this is very common across the board with chemotherapy. Prior to an infusion, most patients are given pre-medications that include antiemetic therapy that is meant to be long-acting. So rescue medications are provided for home use, such as prochlorperazine or compazine. After that 48 hours, then an alternative medication called Zofran or ondansetron can be given in addition to prochlorperazine. Hydration is important during this time, and of course, if symptoms aren't getting better with treatment, then other options can be added in to help control.
Diarrhea is another common side effect we can see, whether that be due to the chemo or sometimes depending on the cancer, depending on where the cancer is spread to. We recommend taking over-the-counter Imodium if a patient calls in complaining of diarrhea. And this is just kind of saying the dosing. Normally it's a maximum of about 16 milligrams per day. If the diarrhea is persisting, then we recommend you reach out again to us. Let us know. We can always send in a prescription strength antidiarrheal medication called Lomotil. Lomotil can be taken 4 times a day. Normally we schedule that and just tell patients to take it no matter what, and then add in the Imodium as needed. If diarrhea is persisting, then we also recommend reaching out again because there are other options on top of the Lomotil and the Imodium. It's also important to stay hydrated if you're having persistent diarrhea, as that can lead to electrolyte abnormalities.
And fever can occur. For most cancer patients, the threshold is 100.4 or more, lasting longer than an hour. So we always recommend reaching out to your clinical team if you have a fever, because it can be indication of an infection, especially while on treatment, since it will affect your white blood cell count. So evaluation at the local emergency room or urgent care can be necessitated so that it can be determined whether or not this is from an infectious process versus from tumor or from treatment.
Neuropathy is another common symptom, or the numbness and tingling in the extremities, and also cold sensitivity. So in these cases, normally after the chemo, depending on what chemo you get, we tell patients not to drink any cold drinks or touch any cold objects. Try to stay away from that for the first few days because it can cause significant sensitivity. If patients are having neuropathy, I know we talked about that a little bit, but acupuncture can help some patients. As far as medications go, we normally tell patients to try vitamin B6. That can kind of help boost the health of the nerves. And some patients require duloxetine. The other name for that is Cymbalta. It's an antidepressant, but it can actually help reduce those neuropathy symptoms.
And mouth sores or mucositis. This is also a common side effect with many of the treatment regimens. Irritation areas in the mouth, mucous membranes of the mouth definitely can affect your ability to eat. Typically, home treatments can include warm saltwater rinses, warm baking soda rinses, but if patients are finding that that's not giving adequate relief, there's magic mouthwash, compounded mouthwashes that can be prescribed that will help soothe those irritated areas. So with less pain, you're able to continue to eat. Another important thing to watch for is thrush, which is a fungal infection inside the mouth. It can look like a white coating on the tongue or on the mucous membranes. And there are medications, especially one called nystatin, which help to treat that.
And I know we've heard a little bit about immunotherapy. So for some patients that do qualify for that, these are possible side effects. We can see fatigue, rash, elevated liver enzymes, pretty much inflammation of a lot of the different organs, but specifically we see more commonly inflammation of the colon, which is called colitis, or inflammation of the lungs, which is called pneumonitis. And it can also affect the thyroid, causing hypothyroidism. And
treatment of these type of side effects, and it depends on the grade. If it's something that is severe, ongoing, then it's not uncommon for treatment to be put on hold. And a taper of oral steroids can help to alleviate the symptoms. And then if it's possible to re-challenge, then that may be an option.
Mm-hmm. And I know this has been discussed multiple times, so we don't have to go into too much detail about it, but for patients that obviously undergo surgery, eating can be difficult. They have to eat smaller, more frequent meals because they can get full pretty easily. They can also have the dumping syndrome that you guys have heard today. So helping limit high sugar intake, eating smaller meals, increasing fiber and protein can help with that.
And definitely at the time of diagnosis, people can present with many symptoms, including the difficulty swallowing, early satiety, reflux, black stools, coughing up blood. We use chemotherapy to try to alleviate some of the symptoms, and also by helping to shrink the tumor, that inadvertently helps the symptoms as well. Chemotherapy side effects are often managed with medications, and then also supportive care is helpful for that. Immunotherapy is another option, but has its own set of side effects as well, and so can often require steroids. Definitely nutrition is important, small frequent meals, watching what you eat, and definitely if there's any type of problem there, feeding tube may be required. But definitely any new worsening symptoms, we always recommend reaching out to your care team. Most institutions have a patient portal or hotline, so there's no question that should go unanswered.
Mm-hmm. Any questions? Nope. Okay, thank you.
May I please have all the speakers from the afternoon session come up on stage so we can have some questions answered? See if, do you have anything online?
Yes, I do have a question from Lisa. She says, can you tell me how often palliative care persons should see or talk to the patient? Can you tell me how often palliative care person should see or talk to the patient?
So it's based on need. There's no set time in terms of how frequently one should see a palliative care physician. It's based, if the person has a need, it could be, and initially it's based on need, and subsequently it's based on what the patient and the physician feel is the best follow-up interval.
Any other questions from the audience? Oh.
I have a question about palliative care as well. I was just curious if palliative care is available in some of the community clinic settings where some of these services are so very much needed.
So the short answer is no. So, but the longer answer is there are community palliative care physicians, but not as many as you would hope or we would hope. But certainly for a cancer institute or for any oncology setting, local oncology setting, they all are aware of a palliative care consultant or a physician they could refer to. So for oncology, yes. But in terms of palliative care physicians by itself, in terms of having a clinic, not as many.
There was a question earlier that I'll repeat. What foods are recommended for plant-based eaters?
A plant-based diet, at least in terms of what we classify a plant-based diet in the oncology setting, would be 2/3 of the plate coming from fruits, veggies, whole grains, nuts, seeds, and then 1/3 of the plate coming from your animal source, likely a protein, like lean protein, like chicken, fish, egg, turkey, foods like that.
Dr. Lau, I had a question for you. So a lot of our patients keep asking us about herbal medications, and they seek our advice as to what do we think about those, especially when on active chemotherapy. Any thoughts on that?
Usually I try to avoid because a lot of the herbs are depending where the source that they're getting it from, there could be interaction. I have a tendency to avoid until they're in survivorship. That's when I can have a little bit more fun working with them in terms of diet, herbal support.
Do you know of any resources where like we could offer them information? Because I know the NIH has certain
So
herbal
Sloan
medication.
Kettering actually has no competitor, but Sloan Kettering has a database on different herbs, and if you read it, you'll actually see if there's interactions. They try to pull as much information that's out there on PubMed and